everyone, welcome to Licensure Hub on YouTube channel again. Last week we discussed various multiple choice questions and we saw how some answers are correct answers and the rationale why those answers were correct. Today we are going to look at some surgical questions that can appear in licensure exams and how to go about it. To begin with, like the question that has appeared on your screen now, which reads, which is the diagnostic investigation to confirm prostate cancer? A. Elevated prostate-specific antigen level. B. Abnormal digital rectal examination. And C. Abnormal biopsy finding. In the surgical department or in surgery, one of the tests that is done to rule out or to confirm cancer is tissue biopsy. And so once the candidate knows that biopsy is done to confirm or rule out cancer, quickly, you should know that abnormal biopsy finding will be a diagnostic investigation done to confirm what? A cancer of the prostate. Next question on the screen. Miss Emanuela Owusu reported to the OPD with a complaint of abdominal pain that feels worse after eating, fever, nausea, and vomiting. Cullen's sign was elicited on examination. Which of the following conditions would you suspect? A. Acute cholecystitis. B. Acute appendicitis. C. Acute pancreatitis. Option A says acute cholecystitis. What then is cholecystitis? In medicine or surgery, using the prefixes that any word ending in itis is inflammation of something. What then is cholecystitis? The word chole has to do with what? The gallbladder. And so cholecystitis simply means inflammation of the gallbladder, which is mostly caused by stones dislodging in the gallbladder or the common bile duct. So cholecystitis is just inflammation of the gallbladder, which is mostly caused by gallstones arising from the gallbladder. Now, in such condition, what are some of the signs that can be seen? The classical sign that can be seen in cholecystitis is what we call the Bloomberg sign or the rebound tenderness. And so that makes option A irrelevant to our answer. Option B says acute appendicitis. As earlier on said, itis is inflammation of something. Appendix has to do with your appendix. So appendicitis is simply what? Inflammation of the appendix. In appendicitis, there are a lot of signs seen over there, such as the McBurney's point or the McBurney signs, the Murphy signs, the Rovis signs, or the Soule sign. But in appendicitis, the classical sign that will be seen there is the Murphy sign or the McBurney's point. That leaves us with no option than option C being the correct answer. And so Cullen's sign is seen in pancreatitis, making acute pancreatitis the correct answer. The next question reads, Amanoya, a 42-year-old mother of 3, has been transferred to your ward from recovery after myomectomy. As the recipient nurse, your first nursing action will be to A. Check rate of IV infusion. B. Assess for pain. And C. Check for vital signs. This is a classical post-op question that needs application. And as a nurse, your post-operative note should quickly tell you that when the patient is back from theater, after confirming the patient is alive by feeling for the breath sounds or the looking up for the rise and fall of the chest, you should quickly assess what? Your vital signs. So from the options, the first priority we'll give to is checking of vital signs. Because the person is back from surgery, you need to check the vital signs in order to ascertain the dynamics going on within the person's physiological response to the surgery. And so the vital signs will be the most appropriate answer. Next question on the screen. Nurse Ajua, a palliative nurse, is teaching a group of nursing students on the classification of malignant tumors. Which of the following systems of classification is not appropriate? A. We have clinical staging system. B. We have pathological classification system. And C. We have TNM classification system. Looking at cancer or neoplasm. We have classification systems for neoplasm, some of which include the clinical staging system, which starts from grade O to grade 4, and then we have the TNM classification. The TNM classification stands for the tumor, the N stands for the lymph nodes that have been involved, and the M stands whether it has metastasized. And so from the options, you will see that clinical staging is appropriate, and the TNM classification, which we'll talk about extensively in our next meeting, is also applicable in classification of neoplasms. And so pathological classification is not appropriate when it comes to what the classification of what cancers. That makes option B the correct answer. I hope you all had a very good time and have really understood the rationales that have been spelled out. Thank you very much for listening, and I'll urge all of you to continue to subscribe and share the Licensure Hub to all nursing students or your friends so that we can have more time to interact and learn more. Thank you very much, and anticipating the next video. Thank you.